Bruxism, commonly known as tooth grinding, is the process of clenching together and the grinding of the upper and lower teeth. During sleep, the biting force of clenched jaws can be up to 6 times greater than during waking hours. Bruxism can cause complications over the years: wear down tooth enamel, break fillings or other dental work, worsening of TMJ dysfunction, jaw pain, toothaches, headaches, or earaches, tooth sensitivity, tooth mobility, chipped teeth, erodes gums and supporting bones, contributing to gum disease. There is no cure for bruxism. However, the condition can be managed. The most common procedure to help to alleviate pain and discomfort is a night guard. A night guard is a plastic mouth guard to be worn at night, designed to prevent grinding during sleep.